now. So that should be recording. Lovely. Okay, so lovely. I will go through. We have got most people muted. I know I'm repeating myself slightly. It's just as a couple of people log in. Throughout the sessions, if you have got questions as they come up, please pop them in the chat function. We have got the teams will potentially be answering them as they go, but we've also got a Q&A session at the end, which will allow us to go through a few bits and pieces. If there's anything you'd like to, we'll try and look and see if there's any common themes. If you, like I say, if you can keep your microphones muted, it just reduces background noise. Throughout the sessions, there'll be a couple of videos and things like that. And as I said, once this is recorded, we will send this out to everybody. Okay, so what we'll do is, let's see if I can get everything. We had a few technical issues this morning, but let's crack on. So this is the plan for the day. So I'm talking just now. Claire will be joining us any second, and then she is going to take you through the nursing degree apprenticeship. I'll be back to chat about the healthcare support worker role, and then we'll hear from both the CUH and ARU teams telling you about part 1, part 2. We've got the lovely Sian who'll take you through some of the remote-based, the Canvas learning environments that ARU use. We've got Angèle will tell you what it's like being a nurse apprentice, and as I said, there's a Q&A session at the end. Okay, so Claire.
I am here.
Lovely. I thought you were. I could have seen you somewhere.
A little job getting in, but sorry to panic you, but yes, I've got in now. Thank you. Good morning, everybody. My name is Claire Fazackley. I'm the healthcare apprenticeship lead for Anglia Ruskin University. I'm joined by my colleagues Liz Hart and Audrey Foster. Liz is the course leader for part 1, and Audrey Foster is leader for part 2 for our adult route, although she will also be happy to field any questions about our child route. We'll also be joined slightly later by our colleague from ARU, who is our Director of Learning and Teaching, Sian, who will demonstrate how you will learn through our learning management system. So a couple of quick demonstrations coming up. I'm going to start by just giving you an overview of the apprenticeship itself, just so you've got a little bit more information about what an apprenticeship is. I'm going to see if I can. Well, no, I can't move the slide on, so I don't know whether, Jenny, you're able to do that for me.
Okay.
Just give you an overview of what an apprenticeship is. So essentially, an apprenticeship is a job with training. So you will all be joining or already be working with CUH, and the idea is that you carry on working as a healthcare support worker while you learn how to be a registered nurse, and we have what we might call a 2+2 model that we'll share with you shortly, that will get you to becoming either an adult or a child nurse. So the apprenticeships themselves are governed by the Education and Skills Funding Agency's funding rules. So there's lots of funding rules that both the employer, the provider, i.e. ARU, and the apprentice must follow. So we've all got different responsibilities and roles within the apprenticeship, but essentially you will be undertaking your normal role, but you'll be training to do something different, and you'll be undertaking new learning. So you will be earning while you learn, whilst following what we call an apprenticeship standard, which is essentially a job description. The first apprenticeship standard that you'll be undertaking is a level 5 higher apprentice to become an assistant practitioner, but following the nursing route. And then the second apprenticeship standard you'll be undertaking is the registered nurse degree apprenticeship, following the NMC 2018 professional standards to become a registered nurse as either a child nurse or an adult nurse. So you'll be undertaking new learning, and the funding is there to provide that new learning. Now, the way the programs work is that we balance the theory of study. So the study of theory will be managed by ARU and through our experienced academic team, but also working very closely with colleagues at our employers, with CUH, to ensure that you get the opportunities to develop your skills in practice. So very much focusing on work-based skills development. It's very similar to the old style graduate or kind of work-based learning courses that ran before the apprenticeship. So we very much mirrored what worked with those and ensured that we've carried those processes on and those learning opportunities, but also within managing them within the funding rules. So you pay nothing. As an apprentice, your apprenticeships and your course are funded by the employer through the apprenticeship levy. So you don't pay the fees, the employer does. So you would carry on working with your normal contracts, and you will continue on until you become a Band 5 registered nurse. So the degree course is part of the apprenticeship, but you also have work-based learning that completes the practice elements of the apprenticeship. And because the second part is registered, is approved by the NMC, obviously we need to ensure that you have the opportunities to extend your practice areas and extend your experience to meet the needs of the NMC. And we do that in partnership with our employers, and also finding new placements where you can't have access to various areas of experience that would help you gather that experience, that breadth of experience. We look for placements elsewhere, and we look for those to ensure that you get that right exposure to different parts of nursing. Now, your employer will protect a minimum of 20% of your contracted hours, which we class as off-the-job learning. We issue you with a block plan at the beginning of each course, which sets out the days that you would be attending university classes. At the moment, they're being delivered online, but obviously, as time progresses, we hope that you'll be coming back onto campus. But there will also be several elements of practice learning. While you undertake your first part, you'll remain in your normal wards or in your normal areas of work. But in part 2, as I said, you'll start to get different experiences to expose you to new areas of nursing. You'll complete all of your assessments on the degree programs as you would normally expect, but the endpoint assessment is what completes the apprenticeship. And there are different endpoint assessments for both the higher apprenticeship at part 1 and the degree apprenticeship at part 2, which we will tell you about when you start those courses. But essentially, it's the EPA that completes the apprenticeship. Now, I know that's just a kind of snapshot of what an apprenticeship is. Obviously, as you start your applications, we'll furnish you with a lot more information. And when you start your courses, then we'll make sure that you understand what your roles and responsibilities are within the apprenticeship. But hopefully that just gives you a bit of an idea of what an apprenticeship is from the first. The next slide I'm going to show you is just a little outline of what you're going to be doing. So essentially, we call this a 2+2 model, which is more or less almost 2 years in the higher apprenticeship, depending on which date you start, and almost 2 years as degree apprenticeship. So you can expect to achieve your registered nurse within 3.5 to 4 years, depending on when you started your first, your assistant practitioner higher apprenticeship. And we have 3 intakes a year. You can start your part 1 in either September, January or May, and part 2 currently in October and May, but we are intending to have a January intake in from 2022. So ultimately, you'll start on part 1 and you'll undertake the foundation degree as an assistant practitioner following the nursing route. I will state that the higher apprenticeship itself is a generic apprenticeship, but we've specifically aligned it to our nursing course so that it gives you that seamless step on, step off opportunity to carry on. So you'll undertake 2 years or 19 months. First part is level 4, 120 credits, where you'll develop your basic knowledge in nursing skills and providing care and promoting health and well-being. So that's a blend of theory and practice. When you move into level 5, which is the second part of the higher apprenticeship, you'll get more used to working with within the nursing setting, but also starting to focus on your field-specific knowledge towards adult or child nursing. So once you've completed the foundation degree successfully and you've completed the endpoint assessment of the higher apprenticeship, you'll then be able to step on to part 2, which is the bachelor degree for either nursing, adult or child nursing. You'll use 180 credits from your foundation degree to APEL to step on to that program. So you only do 60 credits for level 5 because you've already done 180. So you'll do 60 credits at level 5 to further enhance your field-specific knowledge in either adult or child nursing. And then you will step on to the final part, which is level 6, and undertake 120 credits level 6, within your bachelor degree, where you'll focus more on leadership, coordinating care, and you'll undertake your major project before completing the final assessments and registering as an adult or child nurse. So both Liz and Audrey will take you through the more specific details of each of those pathways in a little while.
Thank you very much, Claire. So just before we continue with the nursing apprenticeship, I'm going to take this opportunity to talk through the role of the healthcare support worker. So obviously to take part in the nursing apprenticeship, you would need to either be already working with us or would be planning to join us as a healthcare support worker. Now, with the nursing apprenticeship, as Claire's already said, you spend a certain percentage of your time in academic or in practice learning. The rest of the time you'll be working as a healthcare support worker. So on part 1, that could be up to 30 hours per week, and on part 2, that will be 22.5 hours per week. So I wanted to give you an idea about what that role would be and what that role would entail. So our healthcare support workers will be working alongside our nursing staff. Obviously, when you're on the nursing apprenticeship, this will give you an opportunity to learn from them. All of our wards are very supportive of the nursing apprenticeship, and we will identify our healthcare support workers who are on the nursing apprenticeship by giving them a different colour epaulets, meaning that even if you're not on a practice learning day, it will give you the opportunity to take part in any learning that they've got. If there's any unique opportunities, if it's possible and safe to do so, they will absolutely involve you in that to make sure that you are getting a really good, well-rounded education. So I thought I'd show you an average day in the life of a healthcare support worker. So obviously this will differ depending on what ward you're on, but the idea is to give you some sort of vague idea about the day. So most of our wards will be working on long days. So they'll start somewhere around 7 o'clock in the morning. We don't have all of our shifts change at the same time to make sure that there is a certain number of people out on the floor in case of any emergencies. But generally somewhere between 7 and 7:45 shifts will start. You'll arrive, you'll give yourself time to get changed, certainly at the moment with our new infection control procedures, and you'll sit through handover. Handover you receive from the shift before you, allowing you to make sure you know which patients you're looking after, if anybody's particularly unwell, and start planning what that day is going to involve. Every morning you'll go around and you'll make sure you said hi to all your patients and you've given them a once over. You know roughly who everybody is before you start working, and you will sit as a team and plan for the rest of the day. You will start generally as a healthcare support worker. Your first big job of the day is going to be making sure that patients have got the support for their personal care. So making sure that you're going around, that they have got access to bathrooms and giving them as much support as they will need. Some patients obviously will be perfectly independent and make sure that you've got access to things, and that's all you need to do. But a decent number of our patients will require a certain level of support, and some of them will require a good level of support involving a lot of intimate care. You'll start making sure observations rounds, so you'll be doing blood pressure readings, pulse oximetry, and you'll be reporting all of those and adding them in to the documentation so that the entire team are able to help monitor that patient. You'll be working with the rest of the ward team, and you'll start thinking about getting patients ready for meals, giving them as much assistance as they need to make sure they're eating and drinking well. More observations rounds. You'll be involved in making sure patients have got the support in terms of accessing treatments and tests. You might be going off the ward with some patients to access therapies. Throughout this time, you'll be constantly checking in with the rest of your team. That is the beauty of working on a ward, is that you will be surrounded by members of your team to make sure that you've got the support and that you can make sure that you're working together. As you get towards the end of your shift, so we're looking maybe starting around 6 or 7 o'clock, we start preparing to hand over to the next shift. So making sure that patients are as settled as they can, that we've finished any jobs that are there, that all the documentation is complete, and handing over a really good and well-controlled ward to the next shift. Something that we do get our potential healthcare support workers to look at is the healthcare support worker. Is it for me? There's a couple of bits and pieces on there, and it's so you can think about before you join, is this something that you will be able to do? So the is it for me, there's a couple of things that we sometimes pull out. Communication on there is really important. Communication, regardless of whatever role you're working on a ward, is important because you're working as a team. So making sure you're communicating any concerns about any patients, making sure you're communicating if you need any support, making sure that everybody's got the support that they need. Being able to stand on your feet for a decent chunk of the day is very important. You guys are planning presumably to become nurses, so you'll start off as healthcare support workers, leading on to nurses. We're on our feet for a fair old chunk of the day. So is that something you could see yourself on a 12-hour shift spending a lot of time standing and walking around with patients? Thinking about whether or not you could look after someone and deliver care to someone who was dying in their last days or last hours of life. That's often something that sometimes people find a tad overwhelming, but it is an important part of the role. We care for patients in this trust right the way from birth until death, and it's making sure that they've got the dignity and care that they receive right the way through. Respect is obviously really important, and we also making sure that you're keeping up to date with current practice. So certainly, since you guys will be on the nurse apprenticeship, you will be expected to keep completely up to date with new developments and making sure that you're using best practice. And since you'll be sitting in training with ARU, you guys will be coming out with some of the most up-to-date practice. So it may well be that you're in a position that you can educate the teams around you to make sure that everybody knows what's going on. And then is it going to change? There it is. So we've got a couple of videos now. I had a bit of a what's it this morning trying to make those work, but I think I have discovered how we're going to do it. So let's just stop this, and I'm going to share a new screen with you. So this is a video that has got one of our healthcare support workers in it. Now I will just say this was filmed pre-COVID. So the infection control principles are different, and obviously nobody's wearing masks, but it was before COVID hit that this video was filmed. And just so you can stop listening to my voice for a little while. Lovely.
To start with, we do handover from another shift, passing to another shift, and going into patient, we help them with washing, feeding, checking observations, and yeah, just being with the patient around when they need us. The biggest challenge is to be on your feet on a daily basis, coming and work long hours, and still be able to provide whatever the patient wants. They will support with everything that you need to know in the ward, including a peak, looking after patients and making the beds. That, you know, on the induction we do show on how to do it, but it's not as the same as you doing it on your own. I'm currently doing my Maths and English at the moment for me to become a nurse, and my manager is really supportive on that. It's an amazing job. There is many opportunities that you can do to become who you want to be. And becoming a healthcare assistant, I'm sure that will help me in future to become a nurse, a good nurse to start with. And I think it's a good idea that I started with healthcare assistant, knowing things before I become a nurse.
Lovely. So that was one of our healthcare support workers. We've got a second video. This is one of our ward managers. The reason we want to show you this is because she has come through her entire nursing career with us, so she'll tell you how she's progressed. And I just want you to see it and show that although we're talking about the nursing apprenticeship here, there are plenty of development opportunities, and your development at CUH wouldn't just stop with the nursing apprenticeship. We would develop you further in your career pathway. So this is Chrissy Marsh.
I chose Addenbrooke's to work because it's a big hospital, it's got a good reputation, it's got lots of different specialities and specialist services, it's really good for career and development opportunities, and the support network is really good. They need to be caring, they need to be empathetic, understanding, they need to have good listening skills so that they can listen to the needs of their patients and their relatives, and actually the demands of the clinical area and what that's going to bring every day, so then they can respond to those and act appropriately. I started back in CUH in 2003 as a pre-nursing student. I then went on to be a healthcare support worker. I then went on to be a student nurse, which CUH supported me through for a 3-year course, and I then started as a registered nurse on A4, and I then was a junior sister on A5, and then I successfully became a ward manager in 2015. Some of the challenges that you actually might face might be you might face some patients that are actually really challenging from a behavioural point of view, but at CUH we make sure that we provide you the adequate training and enough support and guidance for you to be able to deal with those patients on a day-to-day basis. If you think that you'd like to go on to become a registered nurse, we can offer you that opportunity, and you could apply for the nursing apprenticeship pathway, which is where you would work part-time as a healthcare assistant support worker within CUH, and then you would have a study day release where you'd attend university and you would study the nursing apprenticeship pathway, and you would become a registered nurse within 4 years. The advice that I would give anybody that wants to become a healthcare support worker at CUH is to go away, especially if you haven't done any nursing before, and get a real understanding of what your roles and responsibilities would be within that position. Speak to anyone that you may know that's a healthcare support worker already, or if you've got friends or family that do any nursing or caring anywhere or any registered nurses, speak to those so you get a real good understanding and knowledge of what you're going to be involved in and dealing with every day.
Fantastic, lovely. So we wanted just to make you aware of the different roles and the opportunities that there would be within CUH, and knowing that they would be involve a lot of what you were doing on a day-to-day basis. So I am going to share this screen again. There we go. And I will be joined by Liz Hart from ARU, who's going to take you through the bits and pieces about part 1 of the nursing apprenticeship. So,
thank you. Yes, so I'm Liz Hart. As I was introduced earlier, I am the course leader for the part 1 foundation degree assistant practitioner course based at ARU in Cambridge in Young Street. And I would just sort of give you some information. Quite a lot of this is what you've already had, but hopefully a bit more detail for you, and then I'll give you an overview of the 19 months in terms of the modules. So as I said, it is 19 months to complete the first course, and we have 3 intakes a year, January, May and September, and we take an average of sort of 50 to 60 students in each of those intakes each year. When we started running my first apprenticeship back in 2017, I had 8 students, and now we're consistently sort of seeing 50 or 60 students per intake. So we've had a massive growth. And during the first course, you will, as has been mentioned earlier, be working for around 30 hours a week, depending on your contract. And then you will be a student for 7.5 hours, so it's protected learning. And those 7.5 hours may be as a learner in university, or presently learning online, whilst we can't have you actually on site. And some of those weeks will actually be in practice. So you'll have modules that are very much theory, so you'll be learning in university, and modules that are practice-based. And during those practice-based days, you'll have a different uniform to wear, and an ARU badge, and you will be attached to a registered practitioner, preferably a nurse or midwife, and you will work with them for the shift to continue to develop your skills and knowledge, and to undertake things that during the rest of the week you don't have the opportunity to do, so improve learning opportunities, and to work against the competencies and proficiencies that we set for you to complete. So those 7.5 hours a week are paid. There are some weeks during the course where there's no requirement during the week, and they're generally the weeks that we prefer you to take your annual leave. Obviously, they do tend to line up with, as much as possible, a few weeks in the summer holidays, a few weeks sort of around the rest of the year, and then a few weeks over Christmas. Now, the university is closed between Christmas and New Year, so we always have that week as a no requirement week. But if you work shifts, you may not be able to take time off at that time. So we do work with you and with the employers to try and ensure that you can still get all of your annual leave whilst not losing too much of your learning opportunities. So on top of your 7.5 hours that you'll do paid, and then your 30-ish hours that you will do in your job, on top of that, you will have to study in your own time, because it is quite a full-on course. You've got lots of assessments to write, exams to prepare for, other reading to do. So we're expecting that you would do around 9 hours a week on average as additional unpaid study. Now that does vary, so some weeks may be quite a lot more, but then other weeks, say in your practice modules, you'll find you're doing a lot less. You may just be reading up about drugs or procedures or conditions in your hours, so less sort of directed private study. And you'll do 7 modules with us. The 6 of them are worth 30 credits and 1 is worth 60 credits. That gives you a total of 240 credits at levels 4 and 5. And 180 of those are taken over directly into the BSc nursing degree. And that will allow you to start at sort of the midpoint of the degree pathway. We do adult, child and mental health, but mental health is not available for students in Addenbrooke's because they only have adult and child wards, and you need to be working in a clinical area that is aligned to that field. So you guys would be able to do adult or child nursing with us, provided you were working in a suitable area. We have a variety of assessments, and really we try to keep them quite varied so that we can play on different people's strengths. So some people may be good at exams, others good at essays, others good at presentations. So we have a variety of different assessment techniques so that where you perhaps are weaker in one area, the other area hopefully will be stronger and will help to keep your results up. And the end of the course does complete with what's known as an endpoint assessment. This is the finalisation of your apprenticeship, so it's not actually related to the course itself. It's entirely related to the apprenticeship, but it's directed by us in the initial part and then taken over by a company who runs it for us. And you'll have various different elements to that, but we prepare you for that around sort of 2 to 3 months in advance of the actual endpoint assessment. And we're very fortunate, I'm very fortunate to have such fantastic students that we've got 100% pass rate for the endpoint assessment at first attempt. So it's nothing you need to get too worried about, but it does just allow your apprenticeship to close and a new one to start. So if we'll just have a look at the next slide. And so this just sort of outlines what you'll do in your 2 years. We call them years, but obviously, as I've said, it's 19 months. So they're more sort of 9-10 months each. And so in the first sort of 10 months, you'll cover 4 modules. 2 of them are practice. So the essential nursing skills are practice modules, and 2 of them are theory. So they'll have written assignments with them. And then you also do a medicines safety exam, which is key in order to progress through to nursing training. And there's one 60 credit module, which is what we call a long module. So it starts in year 1 and it concludes in year 2. So it stretches out over the 2 years so that you have a bit more time to do it. So that submits in year 2, and then you do a field specific module. So you will then break off into groups, the adult group being the larger, because obviously adult nursing is the predominant sort of field within nursing care. And then there'll be a smallish child group and a smallish mental health group, and you will study specifics around caring for that group of patients. Then you'll do practice that again is specific to that field, another practice module, and a further medicine safety exam. And then you have your endpoint assessment. And if this all goes according to plan and you finish as expected, then your endpoint assessment will be completed in plenty of time for you to be able to start the next available top up, which is usually within sort of 2 to 3 weeks to maximum sort of a couple of months later, that you can move on to the BSc degree apprenticeship pathway. So I'll hand back over to Jenny, who'll tell you a little bit about the practice side of supporting our Part 1 students.
Thank you very much. My role very much at CUH is to support the Part 1s. So in Part 1, as Liz mentioned, you've got plenty of theory to be getting on with. You have fewer practice days than if you were comparing it to Part 2, but you do have practice days. They will be based on your usual clinical areas. So if you join us and work on a renal ward, that will be where you would do your practice days as well. The difference being that you would be supernumerary, so you wouldn't be counted in the numbers as a HCA, allowing you to access all the learning opportunities that are available on that ward. So it may well be that that's the time that you spend with the nurse doing med rounds or other clinical activities on the ward, or it may well be that you use that opportunity to go off the ward and arrange some time to go and see a clinic or a surgery happening, or spend time with a specialist nurse. All of which are available. We're a teaching hospital, meaning that we have got lots of these available, and we've got plenty of students, whether they are nursing students or otherwise, around the place. So there's lots of people to learn from. The practice is important, and it allows you to get a real good feel about what a registered role is versus the unregistered role that you're working in. But as I said, you will have that opportunity, even when you're there counting the numbers as an HCA. A lot of people are very happy for you to access the learning opportunities, even when you are counted in the numbers. What it will be is that 1 day a week will be your dedicated apprentice day, whether that's spent in theory or whether that's spent in practice. But that will be it. So different cohorts, different days. So I've got cohorts on various days. But if it was Friday, for example, you wouldn't have a shift on Friday, you wouldn't have a night shift on Friday, and you wouldn't have a night shift the Thursday before, allowing you to make sure that you're well within hours to attend your practice or your theory day. Everything else wise, your shift patterns would work around it. So as I said, you need to be working for Part 1 up to 30 hours as a healthcare support worker, somewhere between 22.5 and 30 hours, depending on the contract that you're on. And you will be working as a healthcare support worker throughout that. When you get onto Part 2, you'll be working full-time. So as a healthcare support worker, you'll be working 22.5 hours on the ward, and your shifts will run anywhere from, like I say, starting from 7 in the morning to finishing at night, and your shift patterns will be decided by your manager. So other than the apprentice day, everything else will be sorted around and scheduled by your manager. Our rosters are done probably about 6 to 8 weeks in advance, giving you enough time to sort of plan ahead. And it also allows you to request various shifts. So if you know that you've got your Safe Med exam coming up and you want the day before off to study, or you know you've got a submission date coming up and you want a couple of days off that week to make sure that you've got the time to dedicate to finishing that assignment, you can request those days to be days off. There are only so many requests per rota, but as long as you're moving in advance and planning ahead, then that shouldn't be a problem for you to manage. Lovely. Okay, so what I'll do is I will hand over now to Audrey and Matt, who will talk to you about Part 2 of the nursing degree.
Hello, everybody. It's a real pleasure to meet you all. My name's, as she said, Audrey Foster, and I'm the course leader for the adult nursing apprenticeships in Cambridgeshire. And of course, I work very closely with Matt at CUH for the apprenticeships that they support. So in a similar way to what Liz did, I'm just going to give you a more detailed overview of what is involved in the nursing apprenticeship course, the part that leads to registration with the Nursing and Midwifery Council. So again, it's 19 months long. You would continue to work in your healthcare support worker role for part of the course, usually about 22.5 hours a week. But on the nursing, the Part 2 course, that actually varies quite a bit. There are a number of placement weeks that are actually full-time in placement hours, which Matt will talk about in a little bit more detail. But usually the theory weeks, the theory time is 15 hours per week. During this course, you would wear a student nursing uniform when you're in placement. And that very much identifies you as a student nurse like any other student nurse, depending on the route that they take. It also means that you have, it's easier to identify you in terms of this is someone who is on the part of the course that leads to a nursing registration. During the course, again, it's slightly different in that you will not work in your own workplace during the student nurse part of your course, during part 2. And this is to ensure that you get the varied experience that's needed to make sure that when you qualify, you are a well-rounded nurse, that you have surgical experience, medical experience, and various specialist experiences. That means when you're qualified, you're able to look after the range of patients that's needed when you qualify. In a similar way to the part 1, you are expected to continue to do, it's actually 10 hours per week private study, and that's to ensure, so it's worth explaining that actually the content of this course is identical to those students who do the direct entry, who apply via UCAS. The content you do is exactly the same. What's different is how you do it. The delivery is different in that, for example, you're expected to do 10 hours a week of private study, and then you do the 15 hours a week in theory with us at university. And of course, a lot of your learning is done in practice in your employed role as well. There's a range of experiences, as I've said, but there's also experiences outside of Addenbrooke's that will be required, such as the community setting or maybe with a GP practice. And again, that's about giving you that varied experience to, again, prepare you to be a well-rounded nurse. Similar to what Claire was saying in terms of the credits, she's already explained that. APEL is accreditation for your prior learning. So we will accredit the learning from the foundation degree onto this course, and you will complete 60 credits at level 5 and the 120 credits at level 6. And I'll go into a little bit more detail about those modules on the next slide. Each module always contains theory and practice that you will be assessed in and that you will have to pass to continue on the course. And in a similar way to part 1, you continue to do safe medication exams right the way through the end for obvious reasons, to ensure that you are safe in administering let me put my teeth back in to ensure that you are safe in administering medications to our patients. I've mentioned already, you need to be prepared that you will have full-time placements. And of course, there will also be times that during full-time placements, you will have assignments that are due to be completed at the same time. And that can be hugely challenging. But we are very supportive. We are available in terms of tutorials, and Matt will talk a little bit about the level of support that they offer as well. But it is challenging, but hugely, hugely rewarding. Lastly, there are unseen exams, and I'll go through the assessments, I think, in the next slide, if that's okay. Thanks, Jenny. Okay, so these are the modules that you would complete with us in the part 2, level 5 and level 6 apprenticeship course. So the first bit is very clinically focused. So that's module 4, sorry. And that's all about recognizing and responding to the deteriorating patient, be that an adult for the adult apprenticeship or a child for the children's apprenticeship. So it's all about really a strong clinical focus, and you will focus purely on those clinical elements when you're out in practice as well. So the placement that you're given will also focus on, so it'll be an acute area where you're looking after patients who do become clinically unwell. In part 6, in level 6, you will have shared modules. So the children's nurses and the adult nurses come together. The one module focuses on developing your leadership across the entire role around a student nurse role, but also, sorry, I was a bit distracted by the background noise there, apologies. So module 5 is very much about leadership. Leadership is essential in healthcare because you are the future of nursing practice. You are the future in terms of ensuring the best practice is implemented when you're looking after your patients. So that is why we work very hard to develop your leadership skills and your understanding of how leadership works in healthcare. The next part is about helping you to become an independent practitioner. So that's when you're coming close to the end of your program, you're about to qualify. So it's all about developing your consistency, your team working, and how you care for a group of patients and meet the standards required by the end of the course. There is an undergraduate major project that you will complete right across that part of the course, and we'll tell you more about that when you start, but essentially it's about a service improvement project where you look to improve a specific area of practice in your employed area. It doesn't have to be implemented, but you will investigate it and plan how it could be implemented. So all about improving practice for our patients. And again, there's a safe medications calculation at the end of the course, as I said. So the assessments that you would have for the leadership module is what we call a presentation that's recorded, an annotated presentation, where you will discuss leadership and how it applies to you and how it applies in practice. There's also an MCQ exam, which is a general exam around nursing towards the end of the course. So MCQ is a multiple choice exam, and that is it in terms of the assessments. Okay, so that's the course as a whole. I think it's over to Matt now, isn't it, for practice?
Sorry, Audrey. Thank you for that, Audrey. So yeah, so my name's Matt. I'm a member of the clinical education team and look after apprentices on the part 2 aspect of the course, alongside a bigger team that look after students within the trust as a whole. And part of that is very much making sure that you are all supported whilst you're on placement. Or have sort of placement concerns within the trust. And we're really fortunate at Cambridge University Hospitals to have such a wide array of different placement areas. And although you will, of course, be spending time on placements external to the trust, because we need to make sure that you've had those really crucial learning experiences, for example, looking after patients within their own home and in the community as a wider perspective, and that's both adult and child. We really have some fantastic opportunities to make sure that we can show you lots and lots of different specialties, lots of different opportunities for you to really sort of broaden your horizons in terms of what you can expect from your nursing placement experiences. So whilst in the first part you are going to spend quite an amount of time on your own ward, become very much experienced within that sort of specific area. In the part 2, we really get to hone in on what you need to have to make you that well-rounded nurse, because we, of course, with this course and any other sort of nursing course, need to make sure that we're not just making you useful and qualified for one specific area, but actually that you've hit all of the targets within that sort of that branch, whether again that be child or adult for Addenbrooke's. And as such, we utilize a lot of the different areas that we've got, and ask for your sort of insight as well in terms of what the experiences are that you need to get over the 19 months that you would be with us in the part 2. How the team that I work within as well support you is very much in terms of seeing you within practice, talking to you about how things are going along, organising supervisional sessions, so making sure that as cohorts, as groups, that we're meeting together to find out what challenges perhaps have been arisen in placement. Maybe there's some unique parts about the specific year or year group that you're in at that stage, that we can actually sort of discuss as a group and find out what we can learn and what other people perhaps have experienced on different areas, and go from there. And we also have the potential to come and work with you to look after you in terms of supporting your supervisors and assessors, who are the people that you're going to be working with an awful lot when you're on placement, to actually achieve all of your proficiencies and make sure that you have achieved all of the skills that you need to get completed within our placement areas. You will do a wide variety of different things within the trust, and again, via sort of collaborative work between both ourselves at Addenbrooke's and Cambridge University Hospitals, and also AIU, we do make sure that you have all of those different areas, and that we are making sure that you've got everything you need to become to reach your potential within your own nursing, and actually be able to reach those sort of goals that you want to by the time you get to that newly qualified nurse position. There will be an increase in sort of placement time in that second part. and that will be something where you can actually really sort of hone those more second and third year type skills, like Audrey was mentioning about sort of leadership and decision making, and those sort of later in the course skills. You will really be able to use the placements that you'll be provided here to hone. Also as well, that we do provide sort of various different sort of sessions for all students within the trust, so that and that will of course be something that you as apprentices within Addenbrooke's will be able to hone in on, and we'll be looking after you sort of every step of the way, whether that be between sort of placements or placement related sort of questions and support. All right, thank you.
Thanks very much, Matt. So I think we have got a video. So this is one of our nurse apprentices. So this film was taken, again, it was pre-COVID, while she was in part 1. She's now moved on. She's now one of our part 2s. So she is progressing. Let me just find the right page. Fantastic. So.
As a nursing apprentice, I'm able to do ECGs for patients on ward, wash and dress patients, help with their daily care needs. I chose to complete the nursing apprenticeship pathway because I wanted to put the theory into the practical, and I enjoy the hands-on clinical skills. I wanted to work at Cambridge University Hospitals because it is a great hospital that delivers amazing care for all patients. I've been a patient myself and received amazing care. My career aspiration is to become a registered nurse on this cardiology ward that I'm currently working on. One of the greatest satisfactions of the job is being a part of the patient's journey. Any advice I'd give to a new starter would be, some days can be really challenging but also very rewarding. As long as you've got good time management skills, good communication skills, you'll be absolutely fine. Just stick at it.
Lovely. So yes, that was just Molly, one of our nurse apprentices. Let me just shuffle ourselves back over here. Lovely. So I think next, which is a lovely photo of the many of us, we have got oh no, there isn't a slide for it. Sian, who is going to take us through the learning management systems.
Hi.
So I'll just stop my share and make sure I have found you.
I'm here. Don't worry.
There we go.
Hello.
Yeah,
Hi.
share your screen. There you go.
I'll share my screen in a minute as well. So I'm Sian Shaw. I'm Director of Learning, Teaching and Assessment at Anglia Ruskin University. I am a nurse. One of my very first jobs was at CUH in the intensive care unit, and I worked there for 7 years, and it was a foundation of my career. So you never know where you can actually end up. Lots and lots of opportunities. So I'm going to talk to you about our learning management system, which is a state-of-the-art platform where we enhance your academic learning, but we also put some skills resources on for you as well. Now, the LMS is called Canvas, and Canvas existed before the pandemic, and actually we were using it for about 4 years before, so that was really good. So it was all set up to continue the support. So this isn't just for the pandemic, this is something that we've been using for several years, but in fact we've enhanced our use of it over the last year to continue to support our students. So I'm just going to share my screen with you so you can see it. If I dash off and stand up for a second, I've got a very naughty little puppy who's at my feet. So if he starts to bite my feet, I might just jump up and actually shove him in the conservatory for a minute. He's wanting his afternoon walk, I think, or his lunchtime walk. So can everybody see a screen now that actually says Essential Nursing Skills and Practice here? Yep, yeah. Good. So this is, and every module that you study which is a theory module, has a Canvas site with it. And we put resources here to support you, but all your lessons, all the resources that are in your lessons are actually here. So the resources will be ideally up 2 weeks before you study, but at least 1 week. And so you can prepare ahead of time for what you've got to learn. And they're there afterwards as well. So I'm just going to show you some of the things that are on here. One of the important things is announcements. So you can see the announcements on the front page here. So the announcements tell you anything important that you need to know. And I would advise you, if you're coming into college, to check announcements every day. Like, I'm going to get this pug into the conservatory because he's going to eat me otherwise. Okay. Sorry about that, otherwise I'm going to have no feet at the end of this session. So the announcements tell you important things that you need to know, and the 3 announcements are the most recent 3 are at the top. So that's really important. There's a discussion section, and one of the really useful sections in the discussion is an Ask the Module team. So you can at any point raise a question on the discussion board and the module team will get back to you with an answer. The answer is shared, so yeah, ask the module team here. The answer is actually shared with the entire cohort. This is actually a new module that's about to start, so there's no questions on it because I didn't want other cohort students for you to actually see. So you will see questions that other students have actually asked, which are often quite similar. Of course, if you do have any private questions that you don't want to share with the group, then you can email your module tutor or module leader directly. And then quite a lot of the sessions may have discussion boards, either which are facilitated by your tutor, or they actually are discussion boards with other students from your cohort where you discuss certain topics as well. So you get to communicate a lot. So in the module section, you have the resources that support your learning. So this is a module where they have a family that you follow throughout the module. So one of the first things that you do is you meet the family that you're going to follow various aspects of for this module. So there's a family tree, and you can see the family tree, you'll probably see, yeah, there's a family tree there. But you can see that the family has a grandfather, mother, father, yeah, and then we've got some children as well, which range from teenagers down to very young children, and some godfathers and extended family as well. So you get to meet the family and discuss various aspects of the care that they need, because of course nursing is nothing but based on the service user or the patient. They are really central to everything that you learn. So yeah, just wait for the modules to go back up. Yeah. So there are some things that are just to help you. So there's some support information on here. So who's who and who to ask, where to get help if you get technology issues, support from student services, from the unions. We advise you to join a union. As a student, it's a useful support for you. And of course, your assessment details will actually be on here as well. So you know what you to expect from the start. Now, going down, there's different learning things. So here we have some support for clinical skills. So when you're learning clinical skills, of course, one of the important things is to practice them in practice at CUH, but we teach you how to do them in the skills labs. At Anglia Ruskin as well, we've got skills labs that are mock wards and really do look and feel like the same thing. But before you come, so this is about doing observations, heart rate, blood pressure, temperature, that kind of thing. And it gives you some reading to do before you go into the session, because preparing yourself before you go in helps you really to learn better when you're actually doing your skills sessions. So, and each skill is underpinned by theory. So there are also some videos here. So the videos demonstrate how to do, how to take a blood pressure correctly, about the national early warning score. So all the skills sessions do have videos to demonstrate what those skills are. So you're going to get lots and lots of different ways of learning. So there will be the resources that are on here, there'll be practice in the skills lab, and of course you'll be practicing under supervision at CUH as well. So just going back to modules. So when you're doing theory, these have actually been set up at the moment because we are in the pandemic, and we are keeping our students as safe as we possibly can. So, and following government guidelines. So only key essential skills are being run on campus at the moment. And the theory is actually being done online, but of course, when we can open up the campus, things will actually change. We'll have more teaching on campus again. But the resources here are incredibly useful. So, for example, what we've actually got here is we've got some self-directed learning resources. So you may have resources here that you can work through at your own pace and speed. And it tells you what to do, what the session is about, what to do after the session. I'm just going to find some, but there are also on here. I think one of the balancing things we've got to actually look at is our balance between online and face-to-face learning, because of course for some students online learning actually works quite well, because if you've got children at home and you've got care requirements, then it actually works quite well to do online learning. But then of course meeting other people and being part of the class and being part of the community is very important as well. So the other thing that there is, I just say drop in prep for practice. I'm just trying to find one. Oh yeah, so sometimes on here we've got tutor-led lecture. So this would be run on Teams, which is very like Zoom that we've got now. And the tutor would give a session on it. But in smaller groups so that you can actually talk and communicate with each other. If you do have an online session or which is a lecture, then that will be available after it's completed here for you to watch. So you can go back and remember what you've and help you with any revision that you need to do. But of course, if you're doing smaller groups that are group work and tutorials where you're having discussions, then we wouldn't probably record them. We can also put you in breakout rooms so you can actually do small group work with each other. But of course, you may well be doing that, more of that in class by the time you actually get here. Well, I'm certainly hoping so, that we will get the campus open again. But I think one of the things that COVID has helped us with is it's given us, it's made us actually really improve our resources online. And as we've actually created those resources for you online, I think we would probably look at what we should actually keep to actually enhance our face-to-face content that we'll be able to do when the campus is able to reopen again. So lots of opportunity for you to go over things and read things ahead and prepare. So also other resources on here that you can use. So reading list takes you through to a reading list that helps you prepare for the module so that you know what to read. You have to go through the library to actually find those papers, but learning how to use a library is a core academic skill. There is usually a core textbook for each module, which is the one that is the recommended textbook to for that module, and the link to that is here as well. University Apps takes you through to quite a lot of resources that are available to book. So I'm just going to click on that and you can see. I have to say my puppy's not looking very happy at me now. He's only 16 weeks old, so he might be destroying a few things, but he's fine. So anyway, so we've got links to things which are useful. So eVision is which keeps track of your academic journey. So it's where you actually register and all your grades are actually kept as well on eVision. The library booking system, so you can book computers in the library. So that allows you to book a computer space in the library so that you know there's one available when you come in. But there's also study pods and rooms you can book in the library as well to study. The library has extensive online resources, so you can actually search lots of papers and books and get access to online books straight from Canvas. We've got a student engagement dashboard that helps us to make sure that you're all right, and it tracks how much you're using the library, how much you're engaging in Canvas, and helps it identify for students who may be struggling to keep up with the learning, so that your tutors can see how much you're engaging with resources we've put on there and offer you help if you need it. Study Skills Plus is a site accessible that the university library collate, and it contains all kinds of resources to enhance your academic skills. So if you're a little bit worried about being able to write an essay or how to reference, or your mouth is a little shady and you need a little bit of help, there's lots of resources on here for you to develop those skills. And they do run some sessions outside your modules that you can go on and in the library to develop those skills as well. And there is specific disability and dyslexia support if you have a statement of needs to actually offer you additional help. And we do have quite a lot of students with additional learning needs, especially dyslexia, within the faculty, and they do manage to thrive and do really, really well. So I'll just go back. And then there's other things. Boxer Broadcast is a video repository where you can record educational programs, or your tutor may record educational programs or clips or edit to upload. You've got LinkedIn Learning, which is masses of learning on a range of things. You know, even how to use Microsoft, how to use Teams, how to do statistics. You'd be amazed at what you can find in LinkedIn Learning. And, you know, RefWorks helps you with referencing. Lots of things here to actually help with your learning. So I think that's about it. So this will follow you throughout. So when you go to your Canvas, I'm just going to go to my dashboard so you can actually see what the dashboard looks like as well. Well, thinking about it. So you can see we sometimes put announcements on the dashboard for our students. So, you know, and particularly a lot of the announcements at the moment are around COVID, because we have to follow government guidance. So your dashboard will have little cards like this on it. So when you go into Canvas, each module has its own card. I have a lot because, yeah, I'm just... but you will start with one module, and these will actually develop. You'll get the additional ones as you run through the course with all your learning resources. So there'll be one for each module with everything that you need on there. So I'm going to stop sharing my screen now. I think there's a question session at the end. So I will answer any questions that you have when we get to the end of the session.
Lovely. Thank you very much, Sian. So also with us today, we have got Angèle, who hopefully will be unmuting herself as we speak. She's one of our...
CUH is a great place. It helps you work and study at the same time and get paid, because we don't have the opportunity to fund our own study. The foundation degree, you have to bear in mind that is very much assistant practitioner level, so it teaches you all of the basics of nursing. So a healthcare support worker role is very much linked to this. So you'll be taking care of your patient on a very personal level, intimate care. So you have to, you know, get ready to help people in that sense. You will go through long shifts, intense moments. There'll be sad moments that you have to go through, difficult moments that you have to go through, but it's very rewarding. You have to have the passion for caring for patients, really, having that communication skills, being a people person, really. It's also something that you have to bear in mind is that you have to give a lot of your own time on top of what you do as working and uni work. So I'd advise people to be proactive. I'd advise people to plan your day and your weeks in advance, not leaving things for the last minute. That's pretty much it. So it can be challenging, but if you have the passion to care for your patients and if you're willing to work hard, you have the support everywhere. So for those of you who don't have the math and English, I didn't have the math and English myself. I was a healthcare support worker in Adam Books, and I worked through my math and English with CUH, so they did support me, the NAP team especially. But if you have your manager on the ward, they will support you with that. You can do that online, especially with the COVID-19 happening at the moment. Also, for those of you who could be a bit worried with regards to working at a uni level, so level 4, 5, and 6 that you go through, I had never studied at uni at that level. And again, all of the support is there. When Sian was saying about a Canvas, and then you can go on Study Skill Plus, and they will help you with that. Your tutor at uni will help you as well. Asking a lot of your people that you live with, your friends, your family, once you've written an essay, maybe to read it for you, proofreading as well, that helps. But yeah, planning your time in advance and also giving extra time to study. Don't think that is just my full-time job, 37 hour and a half mixed from study and working. It's a little bit more than that. So you have to be willing to give a bit more. Don't be afraid to ask for help if you feel a bit overwhelmed as well. The support in CUH is great. There's so many specialty all around as well. Everyone is willing to help you. So yeah, if there's any other question later on, I'm happy to answer that.
So Angèle, how do you find managing your time between work and nursing apprenticeship and getting some sort of life in there as well?
I think it's a mix of making sure that you go to your normal days as a healthcare support worker, having your day at uni, or at the moment on the sofa for me when it's uni day on Zoom, but also adding those times where you might have a couple of days off and you might think to yourself that one of those days should really be for me. And I usually enjoy being with my partner. We obviously don't go anywhere at the moment, but it's a mix of not overwhelming yourself with everything. So I think it's neither leaving things for the last minute, getting the support, and also calculating the days off that you're going to get and what you want to do with them. So that's how I usually calculate that. I'm a planning person with all my post-its everywhere and my dates when I want to have things finished by, and so on and so forth. And you obviously have the deadlines at uni. So I try to mix all of that up.
And how far are you in the program at the moment?
I'm finishing one of our modules, and I have one more module in the EPA that Liz was talking about, the 8-point assessment coming up as well, in the safe medication. In the summer should be my endpoint assessment, so October will be the start of the top-up. So I'm finishing the foundation degree essentially, which is, I think people really bear in mind that it is assistant practitioner, so it's very much a level 4 basics of nursing, rather than thinking the glamorous side and I'm going to be doing the medication and all that straight away. Really take a step back and think, okay, I need to learn the basics first. And for those of you who don't work at CUH, will start working as a healthcare support worker and get ready for that as well.
Lovely, thank you very much. So Angèle's going to hang around, so if there's any questions that you want to direct towards her later on, she'll be quite happy to answer them. So speaking of qualifications and applying to CUH. Here is our how to apply screen. So at the moment we haven't got a live version for applying directly into our nursing apprenticeship, but that's not a problem, because what we do have every month are healthcare support worker vacancies that come up. So our next advert will open on the 1st of February. Our details will be on our vacancies website. What's important, if you know that you are planning on doing the nursing apprenticeship, is identify that. There'll be a question on the form saying, are you interested in the nursing apprenticeship? If you say yes, then your application and your interview process will go via the nursing apprenticeship team to make sure they're involved and to try and make sure that we direct people to areas where they can be supported. If you are planning on joining us as a healthcare support worker first and seeing how it goes and then applying for the nursing apprenticeship, that's also perfectly fine as well. We recruit externally and internally. If you are internal at the moment, our process will be that you will send us an informal application, our informal expression of interest, and that tells us that you are interested in doing the nursing apprenticeship. We'll keep you on a database. So we would inform you about events like this. And we would also make sure that we contacted you as we got up to our formal stages of admission for the nursing apprenticeship. So as we've already said a number of times, there's 3 intakes per year, and as we got up to the time where we would be looking for formal intakes for February, for January, or for May, or for September, then we would contact you and ask you to submit a formal application, and then you go through the interview process with ARU as well. In terms of the admission criteria for the healthcare support worker, obviously we would get you to go through our interview and application process. There would be a maths and English screening, and assuming you met all the criteria, we would employ you as a healthcare support worker. To access the nursing apprenticeship, you need to have GCSE maths and English grades A to C or 4 and above, or functional skills level 2. You need to have been working with the trust for at least 6 months. If you have got a level 3 qualification, or if you haven't got a level 3 qualification, you need to be working with us for at least 9 months before you start on the nursing apprenticeship. That just allows you time to settle into the role. We've been doing this for a couple of years now, and something that we have found that bears out is that people who have had that opportunity to settle into the role, to get themselves really situated on a ward, they tend to find it easier when they move on to the next part of the nursing apprenticeship. As Angèle and Liz and Audrey, and I think everybody have said, there's all this additional time and effort that you're putting in towards your nursing apprenticeship. So what we want you to be able to do is know what you're doing for your nursing apprenticeship and for your healthcare support worker role, sorry. So that gives you that good amount of time to settle in. It also means you've got those support networks on the ward. Once you are in, we will also look for a manager's backing. So regardless of whether you apply externally or internally, we will look to your manager close to starting onto the course to ensure that you are still well enough to get onto the course, being that you're not in any management procedures, so you're not in any management in terms of behaviour or anything else, that you will be able to cope on the course. If you weren't managing to achieve the basic standards for your healthcare support worker role, you wouldn't want to be adding any additional pressure in adding all of the additional work you'll have to do for the nursing apprenticeship. So we would support you to make sure you're able to manage that, and then look at joining you onto the next available cohort afterwards. What's important is our nursing apprenticeship email address on this slide as well. We are contactable most of the time. If you send us an email, we're quite happy to answer it, where there is support through both the application process and once you've started with us and when you are on the course. We're quite happy to answer any questions that you've got, but we are also quite happy to answer any questions that you might have at the moment. So I'm just going to stop sharing that so I can get my lovely chat function up. I know that Natalie and Liz and Audrey and lots of people have been very busily answering questions in the comments, but I have written down a couple that I've seen pop up. Feel free to add any more, and if you want to direct them to a specific person, just sorry, I had a big crash there. Just let us know. So if you want Angèle or any of the representatives from ARU to answer, just let me know. So somebody's asking about where you need to be working if you are planning on going onto the child branch of nursing and you need to be working in a paediatric area. So if child nursing is what you want to do, you need to make sure you're working in a paediatric area. So if you're already working for us, then you would need to think about an internal transfer. And if you're planning on joining us, you need to make that very clear as part of your application process, that that's where you're aiming for. We do have fewer paediatric vacancies purely because we have fewer paediatric areas. We obviously have many more adult wards than we do have paediatric wards. We are getting our lovely brand spanking new children's hospital, so we will be looking for people at some point to make sure that's nice and well staffed, but it's just making sure that's clear. Someone's asked if they can do it from theatres, and the answer is yes, you can. We have got a number of apprentices both on part 1 and part 2 who are based in theatres, and they do fantastically well. Both on part 1 there's an opportunity for spoke days, so experience days out of theatres, and on part 2, as Audrey and Matt said, you will be out, not in theatres at all, doing all of your practice time out and about. Someone's asked about accommodation. So there isn't the student subsidised accommodation available for the nurse apprentices, but we do have accommodation on site, so you'd be able to apply for that, but there wouldn't be the same guarantee that we'd be able to get you something. But as part of your joining the trust, you could let us know that that's something you're interested on, is living on site. And the final one that I picked out was travel support. So while you're in part 1, there shouldn't be any need for any travel support because you are working and doing all of your practice time in the same area, so that should be sorted. When you're on part 2, there is some discussion about the possibility there, but that would be something that we could sort out on a case-by-case basis. So looking at the questions we've got in the comments, so mental health nursing is not something we support in this trust. In this trust, we haven't got the practice area, the placement areas for people to go to support mental health nursing, but it is something that ARU support. I don't know if Claire or anybody else wants to.
Yes, if anyone wants to do mental health nursing in particular, then you can talk to me. There are obviously trusts in the area like CPFT that will support you and will be looking to grow their mental health nurses. So there are opportunities in the area. They're not as frequent, I will say that, but obviously if that's the area that you're particularly keen on exploring, then just message me privately and we can take that offline.
CPFT is Cambridgeshire and Peterborough Foundation Trust that Claire was referring to, and you can look on their website as well. You might find some information there.
Yeah.
Thank you. Someone's asked, would the apprenticeship be cancelled if someone becomes pregnant? It wouldn't be cancelled if you were on programme when you were pregnant. You would go on interrupt, so you'd basically press pause or wherever you were in the programme, you'd go off, you'd have your mat leave, and then when you were ready to return, we'd get you back on to the same moment of the programme that you stepped off of. You'd step back on at that point in time.
And you don't have to stop just because you're pregnant. You know, you can keep working through your pregnancy.
Oh yeah.
Yes, it's not, you're pregnant. No. We've got students who are pregnant at the moment who are, you know, trying to get everything finished right up to the deadline. So the baby is due when the EPA is due. So we shall see whether that's achievable. But yeah, some people step off earlier because they think, oh, do you know what, I just want to, it's tiring and, you know, maybe complications and things. So you can sort of judge your own health and we'll support you with that. So
and that's actually the same for all life circumstances, not just pregnancy, any life circumstance.
Yes,
you know, we are both COH and ourselves work really, really hard to flex where we can to ensure that we help you to continue on the course where that's right for you, or we pause where necessary and get you back at the right time for you and your organisation and the course. So we work very closely together to make it work for you for any life circumstance.
Absolutely. Yeah.
Fantastic. There is a couple of questions about maths and English. So I'll talk some vagaries, but there is an awful lot that we could talk about for maths and English. If there are specific questions about does my qualification count, because there will be some that while they would be accepted by an academic structure, wouldn't necessarily be accepted by the ESFA, the funding agency. We'd always recommend that if you've got a qualification, get in contact with us and we will run it past the university and we will make sure that it is something that we can work with. And if it's not, if we're concerned that it's not meeting the criteria that we need it to meet, then we as a trust, we can help get you through functional skills. We work with a couple of colleges in the area. At the moment, everything they're delivering, same as anybody else, is online. So it's all being done distance at the moment, but we'll take you through functional skills level 2. It takes a couple of months for each, both maths and or English, depending on what you need to do, but it's there, it's free, and you can do it while working at the trust. We have got a couple of questions about, do you need to be contracted? So yes, if you're working on the bank, you need to be working in a contracted role because you need to be fulfilling a certain number of hours per week, and the bank will never guarantee that you can get those hours in, and we need to make sure that you've got that regular placement, so you've got the support from the ward. So, when to apply? So we've got people who might be in college at the moment. When should they apply if they're aiming to join us once they finish their college course in the summer? So as I've said, there is applications that open every month. So I would say you could apply for this one. There's no reason why you couldn't, and go through that application process. And it's just when they would come to agree your start date, obviously you would give them one further in the future. I would say that probably just to make life simpler, I would wait maybe a couple of months and then apply. And then it takes about 2-ish months to get your pre-employment checks and you start thinking about handing in notice periods and things like that. You need to be working for the trust for 6 months before we put you on the programme, but you don't have to be working for the trust for 6 months before you can apply to get onto the nursing apprenticeship. So you can join us with and telling us, and we would accept you on with the plan that you would then be joining the nursing apprenticeship, but we wouldn't put you on programme until you'd met the 6 months minimum requirement, and that you'd got your maths and English, and that you'd got everything else that we need you to have behind you, but we would know that you were getting ready for the programme. Someone's, yeah, there's no upper age limit. There's nothing. We've got plenty of people who might be considered more mature for a traditional university course, but plenty on the apprenticeship. Maths and English in 2008 should be fine. I think maths and English in 2008 should be fine if it was GCSE.
Jenny, shall I just talk about maths and English for a bit? Just,
yes,
because
absolutely.
That's obviously a common theme. So for those of you that have done GCSEs in England, if you did it on the old system, you'd need to have a grade C or above, as Jenny has said. If you've done it more recently with the new grading, it would need to be a grade 4 or above. The ESFA have very, very strict rules on which level 2s they will accept. So whilst ARU has a much wider range for their normal courses, when it comes to apprenticeships, it's the ESFA, I'm afraid, that rule, and they stipulate a very narrow collection of level 2s that they will accept. So if you have a GCSE grade C or above in either English or maths, that's great. If you've got a level 2 functional skills in English or maths, or key skills in numeracy and literacy at level 2, they are also accepted. If you've done English and maths as part of an access course previously, for some reason, if you've done it prior to 2014, they will accept it. If you've done it since 2014, they won't. Please don't ask me why. It's an ESFA rule and nothing to do with me, but unfortunately that's the sort of they're the sort of rules we have to abide by. If you have done your GCSE equivalents outside of the UK, so you've had your education abroad, then if you have a NARIC transcript or a NARIC confirmation that your maths is an equivalent level 2 GCSE, the ESFA will accept that. It does need to be certificated. You do need to have a certificate to confirm that NARIC have accepted that maths level 2 as a GCSE equivalent. If you've studied level 2 or a GCSE English in a country where English is not the first language, the ESFA will not accept it, and they will insist on you doing a functional skills course in English. So hopefully that's clarified it for a few of you. If you've got any concerns or any you're not just simply not sure, then just run it by us, because we will happily give you the advice on whether or not it's accepted before you go down the route of applying, because obviously we want to make sure that you've got the right level 2, and there's plenty of time for you to undertake your level 2s if you haven't. Hopefully that covers everything.
Thank you very much, Claire. Natalie, someone's asked if the 6 months experience on the bank is acceptable as 6 months experience
We need 6 months in a substantive position. But that, like you said earlier, it can be from, you can apply before that for the next available cohort, as long as you've got that 6 months in. It wouldn't, it's not 6 months and then apply.
And I think the thing is, I mean, it would be clear that we're looking at that we've got those 3 intakes a year. 6 months when we actually come to it, it wouldn't be, even if somebody had absolutely everything now, that our next intake, although we've got one starting in May, unless you've got absolutely everything ready to go, we'd probably be looking more towards September, which is 6 months or so away at this point in time. So it's not unusual for that length of time between saying I want to do the nurse apprentice and actually starting on the course. And we're talking about starting, not applying.
It's worth pointing out that those 6 months that CUH support you in doing are actually really important. I do have students who come straight in, start in a new employer in a different organisation, come straight on the course and find themselves totally overwhelmed because they're trying to settle into a new job. They're trying to figure out how that works, and then they're leaving almost immediately to come on placement and don't get to know their team in the job. So for example, for those who join me with a different course onto the part 2, after 5 weeks in university doing theory, they're immediately on a full-time placement away somewhere else, making it extremely difficult to settle into your new employed role. So that's why I would utterly recommend the stance that CUH have taken on this. It makes a huge difference to your apprenticeship going forward.
I think the recommendations from previous nursing apprentices,
Absolutely.
It's a key thing. We listened, we learned from. And they're getting used to a lot of them who've come from full-time college have said that they've just they've worked maybe 4 hours a week. Coming to working shift work 37.5 hours a week or 30 hours a week has been quite tough, and getting used to a new family, it's very, very overwhelming when you first start, but it's absolutely so supportive. But they have chosen themselves to move to a different cohort, so I think listening to people who have been through it is absolutely key.
Lovely, thank you. So just a couple more questions, and then we've got one final video, and we'll let everybody get off and enjoy the rest of their afternoon. So like I say, the applications will come out monthly. All of our vacancies are advertised on our website. If you are joining a healthcare support worker, if you're applying through a healthcare support worker advert, there will be somewhere to make it clear that you're interested in the nursing apprenticeship, and that just helps us make sure that you're placed in the best area. Someone's first year student nurse, I want to be a healthcare support worker and join the nursing apprenticeship. So if you've got previous experience, whether it's current or whether it's from a couple of years ago, we will always run this past the university. The university will tell us how much is appellable, essentially how much of the course is new learning or not. They will be able to tell us at what point you can join the course. So if there are modules or areas that you don't need to do again, they'll take that into account and they'll start you where you can. I mean, I'm very biased. I said I came through a traditional route, and I think the nursing apprenticeship is a fantastic route to go through. I think earning where you learn, we know that we're getting some really fantastic, well-rounded nurses out the other side of it. But it's about working out what works for you. There are advantages and disadvantages to both. There is a lot of additional work that you have to put in for an apprenticeship because you're working and you have to get your shifts and work your shifts around your academic work, and so it does take a lot of commitment, but I absolutely think it is a really valuable route to go down. Right, okay, so we'll do this final video and then we'll let everybody go. Thank you very much for joining us, everybody. It has been a pleasure. Any additional questions that you might have, we will do our best to peel them through. So if we've missed anything in the chats or anything like that, we will go through and we'll send out an email. As you know, we've been recording the session, so we will be able to send that out and you'll be able to access that. Either it will be on the YouTube or it will be a link in some way, and you'll be able to go back and have a look. And if your questions come to you later on, both representatives, ARU and CUH, we're quite happy to answer questions whenever if you send them through to us. Right, so let's do my final screen share off. There we go. So this was created just this time last year for our first lot of nursing apprentices who qualified about a year ago today. So let's just go with this.